So we are joined, I'm very happy to say, we're joined by Dr. Kevin Caldwell here live in studio, and it's nice to be able to do more things with people actually in the studio as compared to over the phone or whatever. And Dr. Caldwell is here primarily in his capacity as the chair of the Del Norte Healthcare District. So Dr. Caldwell, thank you for being with us on KFUG.
Well, you're welcome, Mike, and good to see you're back from the desert.
Yeah, I really enjoy being back in this community and you know, being able to be involved here, you know, and have conversations like this with people like you. So for people who don't know, when we talk about the Del Norte Healthcare District, generally, what is the mission? Why does the healthcare district exist, and what does it exist to do?
So it started as a hospital district that after World War II, many rural communities developed these special districts where they got annual allotment of property tax money with the purpose of having hospitals in rural communities. And so the healthcare was then the hospital district ran Seaside Hospital, and by the 80s it was getting a lot more difficult to do business, healthcare business, and so they started looking around for a bigger hospital corporation who would be able to manage Seaside Hospital. And in the 80s, they finally settled on Sutter. And so Sutter came in as the manager of the hospital. And at that point, the hospital district became the healthcare district. And so their mission shifted. And at first, back there in the 90s and early 2000s, it was divesting of the old hospital and A Street Clinic and building the Wellness Center on North Crescent, Washington, which now houses the Open Door Clinic. And then that's expanded into other ventures, but that was the main work to that point. And then come the 2010s, when Sutter Health tried to take away Sutter Coast Hospital and dissolve our local board and dissolve our local medical staff, then the healthcare district took that battle on. That you were here to manage, not to take over. Since we're talking about Sutter, let's go ahead and talk about a little bit of that. Where do things stand? Because in general, and correct me if I'm wrong, a lot of the issue around Sutter, and this has been on 60 Minutes and other national news, that Sutter has continued to not fully comply with the terms of its community benefit agreement. And as far as I know, that continues to be the case. And first off, maybe we can talk about what the community benefit agreement is and what Sutter is or is not doing related to that. But yeah, I think it's pretty simple that a not-for-profit business, in exchange for not paying tax, all of their profits are to be spent for the community benefit. And what we had exposed back in the 2010s is that they actually take millions of dollars out of this community and send it to Sacramento to the Sutter Bank.
Other than the efforts that you and the healthcare district have been involved in trying to rectify this situation, what have other elected and other community leaders been doing to address this?
Not much. And back in the 2010s, we were working a lot with the California AG office, and they were very interested. And then ultimately, it wasn't until about 2016 when Becerra took over as AG that he finally filed the big lawsuit against Sutter Health.
Where does that stand?
And so it settled at the end of 2019, and that was the many business of these improper business practices had to be changed, and they paid $575 million. And that then, like these big settlements frequently do, is the big guys just tie it up in court and they keep filing other things. So, but just recently they've started actually enforcing it, and so they're starting, and I think they're feeling it. They're having to start to spend some of, divest some of that $575 million, change their business practices.
Is there any figure when it comes to this money that should or will be coming to Del Norte?
So I think that is a story that I don't know the answer,
okay,
because I don't know of any that's slated to come here.
Wow. So it's conceivable that Sutter loses the lawsuit, makes right with the state, and there's really no appreciable benefit for people in Del Norte?
As far as I know, that's very possible.
Well, so of course that makes absolutely no sense.
Well, yeah, but,
no, and I realize that. So Del Norte was a big part of getting this lawsuit filed in the first place, right?
Yes.
Right. And now the case has been won. There's $500+ million somewhere. Uh-huh. Some of it is starting to dribble out, but none of it is actually. Well, I mean, it seems perhaps unlikely that any of it is going to make it to Del Norte.
As far as I know. And it wasn't that the case was won. It was at the day before it was to go to trial, they settled.
Oh, okay. Yeah, it's got to be. I understand
with
now.
No admission of guilt.
Okay. But they settled for $500 and some odd million, right?
$500 million worth of no admission of guilt.
$500 million of innocence.
Right, yeah.
Yeah.
And it's like a lot of these big corporate settlements, that sounds like a lot, but
right.
But when you realize that the profits they made from their illegal business tactics, that over the same time of the fight, they probably had made $3 or $4 billion in profits.
Yeah, so it's really not even punitive.
It's just a little price of doing business.
Wow.
Well, and this is relevant. I don't want to spend all the time on Sutter because we have other things to talk about. But I think to me it's relevant in the fact that we have the healthcare district, the Del Norte Healthcare District, stepping up to address this in, at least to me, what appears to be kind of a big vacuum when it comes to other local entities. And it seems like the healthcare district is doing that related to COVID as well. So what can be done to get some of this money that Del Norte was very responsible in the settlement coming to pass, actually to come to benefit the citizens, the residents of this community?
And the quick answer is I don't know.
Yeah. I think if maybe other people were to stand up and help, maybe that could be something, right?
Yeah.
Yeah.
And there was sometimes the county they were asking questions back just after the settlement, like maybe they could have filed something at that point, but as far as I know, it never got filed.
You are tuned to KFUG Crescent City. I'm Mike Thornton with Paul Critz and Dr. Kevin Caldwell, who is the chair of the Del Norte Healthcare District. So, Dr. Caldwell, you were saying when we were off mic that the healthcare district is also funding swimming lessons for local residents?
Yes, it's awesome.
Yeah. So we have a very broad mission to just improve health in Del Norte County. It's a broad mission, and we have no power. I mean, we just have the power to come up with a good idea, and if we have the money, we can fund it.
Where does the money come from?
Still from property tax.
Okay.
Yeah.
Wow.
No. Please go on about the swimming lessons.
So we were thinking of, the pool is always struggling, and it just dawned on us that, well, greater mission than having swim lessons for all of our kids. And hopefully it'll expand into the group exercise lessons, and because the pool has to raise its rates to keep open, and a lot of the locals gets priced out of it, and so it's like, well, this certainly fits our mission for improving health and safety in the community.
So how do these decisions get made? I mean, I know that the health district has public meetings and people come in and talk about a number of different issues, but how do these kinds of decisions get made related to funding, swimming, or other things?
So it's just the 5-person board.
That's okay. We give you a pass on
that.
Who's currently on the board?
So Mike Young and Tanya Piercy, who's a retired nurse from Sutter, and Beth Austin, she used to work at the library.
Yeah, I know Beth, yeah.
And then our newest is Juan Santillan, who's the scuba diving guy.
The scuba diving guy? I don't know the scuba diving guy.
Well, if you're a scuba diver,
you would know that.
Everyone knows.
If you were out searching for orcas and things.
Us lowly snorkelers, we don't get invited to those parties.
Yeah, his shop down there at the corner, right there. Yeah.
So there's this 5-person board, and issues come before the board, and...
Yeah, and it's not... Yeah, so I think I'm the first doctor that's there. It's never been like you'd have to be a medical person. It's just a good community person who wants to do good stuff for your community. So as far as I know, I was the first doctor to be on it, and then Greg Duncan was the second, and he's...
And so this board gets... How did the issue of the paying for the swimming, how did that develop?
So very simple, like when the pool was reopening and they were saying they had to up the prices, and a couple of us just said, well, why don't we just pay for it? And it was that simple, and then we present it to the board and we put it on the agenda and we vote on it.
And because you have this funding, my guess is probably pretty inadequate to do everything that would really improve the health of this community on a broad scale. You voted to be able to do this, which sounds like a pretty good bang for the buck.
Yes.
That's interesting. And what sort of response have you had? How many kids?
So they said it just started last week, and the first week there were 154 signups.
Nice. That's great. When you get paying for lap swims, let me know, because I want to go back.
Maybe scuba diving lessons.
Scuba diving, I know.
Sure,
they'll take a lowly snorkeler. I don't know.
Yeah.
You're tuned to KFUG Crescent City, and we are talking with Chair of the Norte Healthcare District, Dr. Kevin Caldwell. 12:18 on this Wednesday afternoon. So, Doctor, as a medical person, let me ask you this. When you look at the situation regarding COVID, and then particularly in our community, how are you looking at that? I realize that's a big question, but that's what we try to do.
So we were, from the beginning trying to get help. The public health officer would usually come to our meetings. Of course, the meetings were all Zoom now. The whole pandemic has really made for a very odd year and a half. I suspect for you too. Just to get reports and how we can help them out, and things were looking better for a while. And then like 2 months ago, now we're faced with this new urgent situation where this Delta variant's real, and it's surging and spreading and hitting younger people and easier to spread. And so we were just kind of grasping, and at the same time we have no public health officer anymore. and just grasping like, what can we do to get a spotlight on this and get some more education, because the only practical solution out of this is to get most of our folks vaccinated. I mean, going back on a lockdown is no one's going to do that.
Right, right, yeah, and it's really certainly as you know, and probably most of our listeners know, we're having a real resurgence of this pandemic, primarily among unvaccinated people. Yes. And I was actually looking at some stuff this morning that, of course, it's the Delta variant now, but there's now one coming out of Chile, which is called the Lambda variant, which is apparently, and I am not a virologist or a medical person in any capacity, may even be more contagious than the Delta variant. So it seems like we need to do something. And as Paul was reporting on community service, we have like the second lowest rate of vaccination in the state. Is that correct?
This was a couple of weeks old now, but yeah, talking with somebody from the public health, the state public health office. At that time, and this was about 2 weeks ago, 39% in Del Norte was what this guy said.
It depends how you measure it.
Right, I figured there's something.
I mean, the more common number is 29, which is of the whole population.
Okay.
So the 39 might be 18,
so that was
18
good?
And older.
That was an inflated, like, wow.
Yeah.
Wow. All right, so where does the 29% number comes from? What are you measuring to get that number?
Fully vaccinated of the total population.
The total population. Okay. So what? Not factoring in kids?
Children,
is that what it is?
yeah.
Okay, gotcha. All right.
Or people who have only gotten one of the 2-dose vaccines, right?
Fully. Okay. I think the partially vaccinated is up around 33% in Del Norte.
Yeah, and with this person, this fella on the phone call I was on said, well, you know, congratulations, it's not as bad as Tehama County.
Yeah,
and I'm like, oh man, yeah, which was by like 5 percentage points worse than we were.
And you hear all these stories about all these states down south that are just have these horrible vaccination rates,
40+%,
and they're up in at least the mid-30s.
Right.
Yeah.
Like they're talking. I saw something the other day about Missouri, and I'm going, wow, if only we had that as large a chunk of our population vaccinated.
Right.
So I want to get back to the issue of the lack of a public health officer, but before we do that, I'm sorry, I lost my train of thought related to vaccination rates and that kind of thing. So I'll come back to that.
Okay.
So
I know exactly what that feels like.
Oh yeah, right, yeah. But I still know what my car keys are for.
Right. Yeah. That's the thing. Right.
I may not know where they are or where I left them, but I do know what they're for. So, Dr. Caldwell, you brought up the issue of not having a public health officer. And it seems to me that this is like the absolute, well, I mean, maybe not the absolute worst time to not have a public health officer, but a pretty bad time to not have a public officer, right?
Right.
Yeah. So...
That was great. You just let that hang.
You just let that hang. That was good. That was radio gold.
That was.
But then it goes back to what I said at the beginning.
Right.
The healthcare district has no power. We
Right.
have no enforcement power of any kind.
Right.
Well, yeah, but does the public health officer?
Oh, yeah.
Really?
I mean, that's like an official state. Well, I mean, they're hired by the county, but they have power. They can...
Am I misremembering things, or was it just did Dr. Raywald just choose not to exercise that power with the
he was
pandemic?
very restrained.
Yeah.
So it's my understanding, correct me if I'm wrong, okay? So Dr. Raywald, and I'm not trying to disparage Dr. Raywald in any way. I want to make sure that we talk about the frontline health workers as well, because that's a different part of all of this. But it was known that Dr. Raywald was going to retire, right? I mean, this wasn't a secret.
Correct.
So we know that the public health officer is going to retire, but yet it seems like, and could there have been more done to try to have someone else in place at this time of a public health crisis, and perhaps an even more deep crisis that could be just around the corner?
So it sure seems like, I mean, they knew that date was coming, and I don't know what they've done to.
Well, and part of it for me is that, so, and I apologize, I don't know the person's name. I saw it, but I can't remember it. And that there was another person involved with public health who had a contract.
Yes.
And that person's contract ended the same day that Dr. Raywald retired.
Yes. And I think he has very graciously stayed involved, at least. He's not the public health officer, but he's helping them out in little ways that he can.
Okay, but
he's not
as a volunteer?
No, he's probably still getting paid,
Okay.
but he's not taken over as public health officer.
Because they could put a qualified person in as an interim. They could probably just appoint somebody to do that, couldn't they?
Yeah, because technically it is an appointed position by the county supervisors.
Right. So if there was somebody who had the requisite skills, the supervisors could appoint somebody immediately if they wanted to, correct?
As far as I know.
Okay.
Okay, I'll do it. Yeah, so I wonder, is it the supervisors who haven't acted, who didn't do, who dropped the ball on kind of trying to have a seamless transition?
Well, I mean, I think it's a legitimate question. I mean, obviously, I don't know what's going on behind the scenes and all of that. So, I really can't say what happened. I don't know if you have any more insight.
No, just that they could easily say we've been hunting like crazy and we just can't find any.
Which is incredibly possible too, right? Yeah.
And you are tuned to KFUG Crescent City 101.1 on your FM radio dial, worldwide on the internet, kfugradio.org. I'm Mike Thornton, joined by Paul Critz, and our guest live in studio is Dr. Kevin Caldwell, chair of the Norte Health District. So I remembered the question I was going to ask you before, and that is, it seems to me that this community, because of its poverty, lack of health care, seems like a fair number of elderly patients in poor health with a lot of coexisting conditions, that we're really ripe for something really bad to happen here with COVID. And perhaps the only thing that has saved us to the degree that we've been saved is the isolation of the community. Does that make sense?
It does, yeah.
Okay, that leads me to this. So the reason that I contacted you specifically about what the healthcare district is doing with COVID is because of an article that was written by Jessica Sanar of the Wild Rivers Outpost. And so I was looking at it, and first I just gave it a cursory look, but then I looked at it more closely, and I believe, I'm pretty sure, that I read in that article that only 51% of the health and human services workers in this county are vaccinated. Does that sound right to you?
Very plausible, and I think that's true nationwide also.
Right. Okay. Well, I mean, the reason why I'm bringing it up is that my experience with health and human services in general is that this is the department that is dealing in many cases with some of the most vulnerable people in our community. And yet only 51% of the staff is vaccinated. To me, that's a problem.
It's a big problem.
It is a big problem, isn't it?
And I think, there's a one bright light is I think physicians are way up in the 90s.
Good.
Which is good. But I think healthcare workers in general are like in the 50s.
Okay, so here's the question. How do we convince, cajole, encourage people in the general public to get vaccinated if only 51% of our social service and health and human services workers are vaccinated?
Yeah, and that's the thing I'm trying to capture is 46 years since I started medical school.
Right.
I have never seen such a thing in 46 years, such massive opposition to what the medical and scientific community is telling people. And it's just unprecedented.
Expand on that. I mean, I factually, I understand what you're saying, but can you speak more to that?
It's like traditional, medicine when I started in 1975, it was the doctor-patient relationship was everything. Mm-hmm. And from day one in medical school, day one wasn't studying anatomy and physiology. Day one was, do you realize what a special responsibility you're taking on? Wow. Because once you get there, you got to be the most honest, the highest integrity. You have to make sure you don't do anything for your own gain. Everything, you have to have that trust with the patient that you're doing it for what's best for the patient. And that was routine back then. The doctor-patient relationship was everything. And living here, so I've been here in the community for 37 years and always had great relationships and really felt like, you could get behind that exam room door and have good conversations and explain, and people are, if they're worried about something, you could get to the bottom of it and give them the facts, and a lot of times it's just what my opinion is, but based on a lot of research. And that's how medicine should be, and that's how it was until recently. Mm-hmm. And it actually started back with the corporate takeover of healthcare back in the 90s. Sure. And when, there was the famous story of one of the new HMOs when no one really even knew what an HMO was. Mm-hmm. So it's executives, these big shot executives who are not medical. But they see how much potential money there could be in healthcare, and they want it. And
sure.
So this one big executive was caught saying, those damn doctors are standing between me and my money. And then there's been corporate strategies ever since to marginalize doctors, to disconnect the doctor-patient relationship, and make the patient more attached to the corporation, mm-hmm. to the brand. Mm-hmm.
Which is a lot of what is behind direct marketing of prescription medications
yes. mm-hmm.
to people in the public.
Yes.
Right. So that leads me to this. There seems to be no corporate financial interest in doctors and other healthcare workers not promoting or talking to their patients about the importance of COVID vaccination. I don't see how there's any money to be made in that. But I am wondering how many doctors and other healthcare workers are not engaging in those conversations with their patients, one, and two, because so much of this has gotten sucked into the culture war. And there's a lot of times been real hostile blowback against people who have been vocal about the need for vaccinations. Does that make sense what I'm saying?
Mm-hmm. Yes.
Can you speak to any of that?
And that's part of what I'm just still boggled by. This is, in the exam room, if they get hostile with me. I've never had that before. Wow. Never had that. And it was like, I'm just asking the question, and boy, they don't like it. They get hostile, won't discuss it.
Huh. Do you ever get any of the 5G response or the microchips or any of that?
They're not No, not that.
Yeah, because somebody, I think it might have been Lynn who was saying that she's heard people talking about, the time released microchip trigger. That's
you have 4 to 10 years, and then all of a sudden we'll be zombified. I'm sorry, please.
Yeah, I mean, just the irrationality of it. It's like, how do you counter that? That you have a microchip, and I said, but you do have your smartphone sitting in your front pocket.
Yeah.
I mean, the government already knows where you are,
right?
And they're listening to your conversations.
Yeah. All you have to do is read the news, and there's another thing about the NSA spying on somebody. It's not a secret. They don't need a vaccine with a chip to do that. Yeah.
I'm interested in the history that you laid out when talking about when things changed and how you can end up nowadays in an exam room with a patient who's becoming like hostile to you for suggesting things that totally in your wheelhouse, and what you're taking the personal relationship out of medicine, taking that, which is a very old school kind of idea nowadays, because I was in the hospital for kidney stone stuff 5 years ago, however that long was. It was horrible. And I, through the course of multiple visits to the emergency room, I experienced 2 generations of doctor. And one was a guy who was probably about 10 years younger than me, who's a cool guy, really cool guy, long-haired dude, surfer dude from Humboldt, comes up here and helps out. Great, thanks. He sat across the room, looked at my chart, looked at the numbers, talked to me about stuff, and I'm like, okay, cool. The other guy I saw laying in there on an exam table, and I think a different visit, and he was a much older doctor who came in, and he was touching me. He was moving my feet, bending my leg, just kind of getting a feel for just what's going on. And that sort of approach right there seemed a generational difference too.
Yes, and unfortunately I think it's real.
Yeah. So one of the things that has been lost by having that personal connection and having a personal, your own personal doctor, your doctor, one of the things, taking that human relationship out of the economic model so that you could have HMOs and you could have, more standardization of care and all this other stuff that, is dollar signs attached to it. That is the underlying reason why maybe, in your estimation, in your opinion, the experience, the credibility gap that now exists between, that because of that, then you find yourself in an examination room now with a patient who's becoming hostile because you've suggested a perfectly reasonable healthcare.
Right.
Wow.
And it's almost like it's expanding. I mean, it was corporate forces that they, once you separate that bond, there's a lot of energy gets released.
Oh, there you go.
Just like and it goes to the corporate leaders that now they get the power. But just thinking now it's like it's expanding to political leaders. Yeah. They see you break that bond, and then they get the energy.
Wow. No, that actually,
that's really interesting.
That actually makes a lot of sense, because I mean, and it's not original thought on my part, but that there's a lot of, that the more people get atomized and individualized and unmoored from any kind of grounding, it's easy for for people to spin off in all these various directions and start looking for things to attach to. And sometimes it's the loudest voice in the room, and that loudest voice is just full of BS or full of making statements that benefit them at the expense of, whole communities, right? I mean, that's kind of in some ways what we're talking about here.
Oh, I think that's completely. I mean, I go back to my college days when I was a genetics major and an anthropology minor. And that was, it's so fundamental that humans are social creatures and they survive by working together. So those bonds of everyone in society are essential for the success of that society.
For the very definition of that society, that's what it is are those bonds, Yeah, wow.
So like the doctor-patient relationship is sort of a subset of those bonds, but everyone needs to be bonded to the other people in the community so that the entire community succeeds.
Okay, well, now we know Dr. Caldwell's stance on bondage.
Right. and we are talking with Dr. Kevin Caldwell, chair of the Norte Healthcare District. You are tuned to Community Radio KFUG Crescent City. I'm Mike Thornton, joined by Paul Critz and, of course, Dr. Caldwell. So, because... And this, I mean, it's a little bit different in a community like this, but for the most part, we don't have semi-intimate relationships with everybody in the community, right? You know what I mean? So very often this bonding takes place through and I may not be saying this correctly, but sort of the avatar of leadership, if you will. Like we were talking earlier about the sword and the shield, and having, someone who is vocally and forcefully saying, what needs to be said, right? And so that leads me to this. The Redwood Voice crew went to request our elected officials, both city council and board of supervisors, to record videos encouraging their constituents, the people who look to them, to get vaccinated. As I know only 2 actually did it. 2 others said they would but never followed through. And so out of 10, that leaves the rest who never even bothered.
6 never responded at all.
Never responded at all. And so, I guess once again, and I want to get to what the healthcare district is specifically doing to try and encourage people to get vaccinated. But once again, I mean, the challenge seems to be, for all of the reasons that people cite for not getting vaccinated, and some of them very genuine concerns about the safety of the vaccine and all of that, I sort of separate those folks out, that it's a different category. But once again, just like if only 50% of our health and human services workers are vaccinated, and only 2 of our 10 elected leaders will actually stand up and say, hey, this is an important thing for our community, and we've got this really, contagious variant on the way, it just seems like it makes what our frontline healthcare workers are trying to do all that more difficult.
And so then I'm back to, this is unprecedented, and it has me overwhelmed. I just never could have imagined being in this position. When you've got the answer, it's a safe, effective answer, and it'll help all of society, and most people won't do it.
Yeah, please.
I hadn't heard that said out loud, but that's what really drives home for me, like, are the numbers, the vaccinate. Is it that, we're talking about most people in Del Norte. Yeah. And I think that's what, because most people I interact with aren't that group.
Yeah.
But that's the reality of it. That just struck me. I'm sorry. That just was like a gasp sort of moment.
Yeah. Well, I mean, and I think it's really important for us to, say things as they are. These are facts. I mean, this is, if I'm giving my opinion, I'll do my best to say it's my opinion.
You do that, yes.
But this is like a fact. Right? This is like an objective state of things. So there's a couple of things. One is, I get really concerned about the emotional and mental health of frontline workers and physicians who are dealing with this kind of uphill fight. Is that a legitimate concern?
Oh, yes.
Can you speak to that?
So, and it's, I think it's more of a big city thing, the big hospitals where they're just overwhelmed.
Just crushed, right? Yeah.
Overwhelmed. I mean, here we're not overwhelmed yet, but it is. And now this, it felt heroic the first wave and maybe the second wave, but now by the fourth wave, it's almost seeming suicidal. Mm-hmm. Like, why? There should not be a fourth wave. There should not be overwhelmed again.
Right. Yeah, and those days of, people applauding and serenading healthcare workers in the streets of New York City, those are past. People have moved on.
Yeah.
So, quickly, I'm thinking back when I was a kid, right? And it was at the end of the polio and tubercular sanitariums and all of that, but they were still very much there in the middle of the community that I grew up in. And I was a kid, but I don't remember like all of this ballistic opposition to like polio vaccines, tetanus, measles, all of that stuff. And how many hundreds of millions of people have been vaccinated and they're fine. They didn't like turn into zombified Microsoft robots or whatever, right?
Yeah. And even a more recent, remember back 15 years ago about there was a pertussis.
I do remember that.
It wasn't huge numbers, but it was an outbreak, kind of went from 0 to 10, and then this was a big deal. And that's when the pertussis got added to the tetanus shots. And everyone was encouraged to get a booster because typically adults carry it. They frequently don't get sick, but they give it to the babies, and the babies die from it.
They get very sick.
That's horrible to see,
Yeah. And so there was no opposition back then. Now everyone gets their tetanus shot with their pertussis booster. It's normal obstetric care now that the pregnant mother gets vaccinated with pertussis, and it's a deal. If anyone in the family, anyone who's going to be around this baby, has got to get a booster before the baby's born, and that's. And I mean, we have, grandparents coming in going, "Hey, I'm getting my booster,"
because I get to hold my grandbaby.
Yeah. Please.
But that doesn't. But again, it comes back to so what is going wrong now?
It's really quite something. I mean, and just very, and I will say this, the claim that vaccines caused autism is complete BS. The person who wrote the paper in the first place retracted it. So let's just put that aside. And I think you said this already, Dr. Caldwell. The mRNA technology has been being developed for like 30 years.
Or 20.
30 years. And so now it was just like a just-in-time kind of thing.
Right.
It was there. It was able to be utilized. So it's not like it was just like, let's find some cookbook recipe out of a drawer.
Yeah. So it's again, because the bonds are broken and nobody's listening to each other, you can't get that message across.
Right.
mRNA technology is an enormous scientific breakthrough.
Yeah.
It really is.
I'm really excited about this. Yeah.
Well, my understanding is that it holds the possibility of doing many things and being able to be used to address a number of diseases, including possibly cancers and things like that.
Yeah, and it's already being used with chemo. I mean, it's been used. It just hasn't been used with a vaccine.
Oh, okay.
But yeah, so there's a lot of research. It's already being used, and that for society, it's lucky that the discovery came along, and then it's lucky that it really works well. I mean, that's just fortunate.
So we have the answer. It's free, right? We don't have to pay for it. And we're still at 29%?
Yeah. Well, and that gets to our healthcare district program. It wasn't out of like, this is some brilliant idea. It was more like out of desperation for like, what can we do just to shine a spotlight on this problem and try to get people's attention and use it as an opportunity for more education. So it's and like everything else, I mean, a good chance it'll just go down in flames.
Well, let's talk about specifically what the healthcare district is doing. And so my understanding is that there is going to be a program of incentivization.
Yes.
Talk about that.
So it's being developed now. We got Amber Weir and California Consortium for Health or something, so to administrate it. So, and she's been brilliant and creating all of these education things and how the whole program's going to work. And then the first thing she did was get Deborah Wakefield in, who's been the staunch warrior for vaccinations going back to December. And she has a whole posse of friends, so they do tons of volunteer work.
I witnessed Deborah in action at the fairgrounds when the county was running the vaccination clinics there the 2 days of the weekend. She came in and she was like, in the video.
Yes,
she's right. And she was like, we were there for one of the meetings beforehand at the beginning of the day, and it was like the beginning of Hill Street Blues. She was, it was really cool. Yeah, she was in charge, very much in charge. Yeah.
And she'd see how it probably won't be till Monday till it officially starts, but she would be more than happy to come here also. And
there you go.
And talk.
And talk good, yeah. I'd like to have her. She was, because we pointed the camera at her and said, "Tell us why people should get vaccinated," and she just boom right there. This 10-second. It was beautiful, yeah.
And that's when I was talking to her yesterday, and it was we were discussing this thing of the doctor-patient relationship, and I was saying to her, I mean, I feel like a failure in this, and she goes, "That's the story. That's the story. That's the essence." And especially given my history for my whole life, I am such a skeptic of the medical industrial complex.
Right.
I mean, I don't like these pharmacies have done such unscrupulous things. When new things come out, I'm like, let's look at it, let's study it. And I said the same thing back a year and a half ago when they said, okay, we're going to research this new vaccine, and people would say, are you going to get it? I go, well, I don't know. I haven't seen any data yet.
Which is a reasonable position when it's like, right.
And then when you did see the data and it was really good, it's like, okay, I did. I'm getting it.
So the healthcare district is going to do this incentivization.
Working with Amber Weir. And so my understanding is people will be able to enter a drawing, a raffle of some sort?
Yeah, so there'll be 3. The first pool is the newly vaccinated. Once they'll go into that pool.
Okay.
And once a week, they'll have a drawing, and there'll be 3 prizes, $500, $250, $100. And then there'll be another pool that everyone who's already vaccinated.
This is what we were for.
I was regretting getting vaccinated.
Do we got to buy tickets, or do we got to win the Cupid doll first, or what?
No, you just have to enter.
Okay.
So there's going to be materials out there and how to do it and how to enter, and so then there'll be a drawing once a week from that pool for saying $500, $250, $100, and then the pool of newly vaccinated, they'll have their 3 drawings, and then the rest of the names will go into the already vaccinated.
So we have to get in on the ground floor to have the best odds.
Yeah. And then the third way is for the 12 to 17-year-olds. It's going to be gift cards from local merchants.
Neat.
So they're going to get a $15 gift card when they get their first shot, and another $15.
Oh, no drawing. Just you show up for your shot. Here's your gift card.
Pick one from whatever, from many local merchants, and just pick which one you want.
Wow.
So here's my question, and I'm going to ask it for 2 reasons. Is this going to be limited to Del Norte County residents?
Yes.
Okay. And the reason I ask is because I am not legally a Del Norte County resident, so there goes my chance. I'll give you my ticket, But the other reason that I was going to ask is because I know, like, when I got vaccinated, I was actually, in the desert in Arizona, but the nearest vaccine was in Coachella, California. But at that time, the state of California said, we don't care where you live. live. You can
Right.
get vaccinated here, and you can get vaccinated anywhere. And the other reason I ask is because we have so many tourists coming in and out of town. Right, a lot of travelers coming through. So this will be limited to Del Norte County residents.
And mainly the reason because it's the Del Norte Healthcare District,
Sure,
and it's
right.
Del Norte money.
Yeah. And well, and you don't even have anywhere near enough money to actually be able to. We will vaccinate the world! Yay!
Powerball. Yeah. The how many weeks are you funding this for? How long will this go on?
So I think the strategy is to not to say, just
Ooh.
get in now.
Okay, all right.
Because it could end anytime.
This is your chance.
I think you guys are handling this perfectly, actually, because I'm all interested. Wait, well, okay, tell me more.
Yeah.
And by that, then you tell me less. Wait a minute.
I'm hoping maybe like DraftKings will have like a daily fantasy thing.
Fantasy vaccination.
Fantasy vaccination. That would be good. Yeah. And I'd do better than my last MMA card.
What's that going out to you, Chris Paul?
Yeah. It's like I say, the idea is to get interest.
Right.
Yeah.
And just as small.
And so now there's also going to be something at the county fair.
Yeah. That's going to be one of the things at the Office of Emergency Services booth.
Okay.
There's going to be lots of educational stuff, and you'll be able to, people already vaccinated will be able to enter. And they were still working out the details whether or not they could actually be giving vaccines at the fair.
Well, and that was going to be my next question. Would there be any medical reason why they couldn't? I mean, I wouldn't think there would be.
No, it'd be.
Is it just a matter? Well, okay, so
I think a lot of it's just logistics.
Okay, well,
so much, but,
no, you go ahead. I'm sorry.
But if Deborah's on it, I'd say
she can do it.
Chances are good it'll happen.
Well, and the reason why I'm asking, because I believe that people, I'm assuming the workers of the public health department and or others, made efforts to have pop-up vaccination clinics at the farmers market.
What I heard was both farmers markets said thank you, no.
Yeah, at least the Saturday one did.
Yeah.
Right.
The Wednesday one said you could set up in the plaza on the other side of the library, kind of out of sight.
And the county is doing, pretty much daily vaccines and moving them around.
Yeah, there's a
Right.
whole schedule, right? Yeah.
Oh, and I guess what I'm getting at is if there is an impediment to having a actual vaccine clinic at the county fair, would that impediment be political concerns about having it there, or being able to have the vaccine there?
Yeah, or they just don't have a refrigerator big enough.
Yeah.
Right.
Yeah, so I think Deborah and I went to the fair board meeting Thursday evening, and they were very supportive.
Oh,
So
good.
it was
I'm glad
kind
to
of
hear
like,
that.
Run with it.
Yeah.
Too.
Great. So we're just about at the end of the hour, Dr. Caldwell, and so just final thoughts and how people might get more information about what the healthcare district is doing related to COVID and or other things.
Or the call out for the public health workers.
Oh, yeah. Let's make sure that we do this first, please, because I know you were very insistent about this.
Yeah, they have been doing above and beyond the call of duty.
Mm-hmm.
And I think when things were slowing down, they took away several county workers, and
Mm-hmm.
now things are skyrocketing, and they need to get those extra workers back. But they've done a great job. And it's like my wife, Dr. Sund, for our office, she was the main liaison with the public health department, and because she'd have to go there, we'd have to have everyone lined up. She'd get all the stuff from them and bring it to our office, and we'd do all the vaccinating. But she was like, they were just doing an incredibly big job, and were very great to work with.
Let's make sure that we give them all the props that they deserve.
And on top of the job they're doing and the logistics and all of that, but they were very passionate and dedicated.
Right. Yes.
That's what was striking for me.
Yes.
So, any other final thoughts or contact information that you'd like to give out?
No, and I think maybe
Well, I like a straightforward answer. That's good.
I'm just thinking like by Monday we should have all the details worked out.
Okay.
And then it would be good to get Deborah.
Okay. Well, and I'm sure we can do that.
And I also, of course, yeah. And I also want to offer too that when there's time for messaging and getting word out in the community, both KFUG and Redwood Voice are down for whatever you need: video,
Yes.
audio, being back on the radio, whatever.
Yes.
Cool.
Dr. Kevin Caldwell, Chair of the Healthcare District here in Del Norte, thank you for being with us on KFUG. And Paul, thank you for being here and helping with doing this interview. Really appreciate it.
I really like sitting on this side of the desk.
Yeah, well, I thought about that. I said, because it's actually a lot easier. It
really
I mean, well, it's not like this is like, it's not like digging a ditch. You know what I mean? But that chair's a lot easier. Yeah. Yeah, and let me say, I'm getting texts about people wanting me to go to like Austin to march, in the Poor People's March. I mean, I'm not going to go, but they're cordially inviting me.
That's very
along
nice.
with millions of other people.
Yeah, well, I didn't get an invitation.
Yeah. Well, it's because your phone's in the drawer or something.
Something over there.
Dr. Caldwell, thank you very much.
Well, you're welcome, and that was fun. You're right.
Great. Really appreciate it.